Borderline personality is an Axis II diagnosis, which affects about 2% of the population. People with borderline personality disorder have intense and volatile relationships, display reactive moods, impulsive and self-destructive behaviors, and have an unstable sense of self or self-image. Becky, a 23-year-old college student, has been diagnosed with borderline personality disorder. In the following segment, Becky dramatically describes two of the characteristic symptoms of this disorder, including inappropriate and intense anger and recurrent self-mutilating behavior.
When I was in high school, I wanted to go to the park with my friend Sean, who was the guy that I was totally in love with for 5 years. And my mom kept telling me no. And, you know, she can't tell me no. We ended up getting into this physical fight with my dad and my 4 brothers and sisters standing over there watching. You know, and she's tackling me to the ground, and I'm screaming, trying to scratch at her face and grab her hair. And so finally, I'm like, fine, just take the goddamn keys. And she takes the keys, and I get up, and I just start screaming. I mean, I'm taking plates, and I'm crashing them on the floor, and I remember I picked up a big chocolate cake and just threw it against the wall as hard as I could, and just literally just went berserk. Just, you know, do you want me to slash my goddamn wrist? Because I'll slash my goddamn wrist if you want me to. You get so mad and so upset, and you feel like everything is so out of control that you just scream as loud as you can. And you beat yourself with your fists until you just stop, and you're so tired you just cry. And then when you can't cry anymore, you just lay there and you breathe until you calm down. You don't know how to deal with the emotions that are just welling and bubbling up, and you feel like you're going to get out of control, and the whole point is to be in control. So you go and you just do the cutting, you slice, and then as you feel the pain and then you feel the blood coming out, it's calming. The cutting is a way to punish yourself for having these bad feelings, for being irrational. Because on that level, you know that you are being irrational. You know that, you know, what are you doing? So it's a fast way that you can punish yourself for being bad like that. And because you don't know how to cry, it's kind of like, I mean, when you cry, the tears disappear and they're gone. But when you cut, I mean, the blood flows, and the blood flows, and it stains the towels that you use to clean yourself with, and it's this wonderfully red, vibrant color, and it's kind of almost like a cathartic release of some sort. It's like it's cleansing. And then for the days afterwards, while it's scabbing over and healing, I mean, your clothes rub on it, and you know, it irritates it, and you can feel it, and you remember what happened. And all you have to do is kind of rub it or touch it, and you know, you can feel the pain, and you remember what happened, and in more of a minor way, it just reminds you of the cutting session, and it helps calm you. First I started with my lower arms, and then I realized, well, it's harder to cover those, so then I moved to my upper arms. And then at this point, it's just making scars over scars. So then I moved to my abdomen, and then I moved to the sides of my thighs.
People with borderline personality disorder experience chronic feelings of emptiness. They often become involved in a series of highly unstable relationships. They are irrational and have a pathological fear of abandonment.